Hi everybody, I'm Jonathan Pierce with Pierce Performance, and I'm back this week for our next performance tip. We're going to start a series of tips around how to build or screen for hip mobility issues and then build better hip mobility. So hip mobility or lack thereof is implicated in all sorts of injuries, but especially things to the hip itself, to the problems of the knee, and even downstream into the calf, etc. So anytime that we have injuries in those areas, I want to know how we're doing here. If you have back pain as well, that's another reason to do this. So let's look at how you can assess if you have good hip mobility. You can have somebody help out, like I am. You can do this on the floor. You don't need a table, but you can have a helper, or you can even do this on your own. If you can look in a mirror, if Paolo were looking in a mirror, he could actually see how he's doing in his hip. All right, so the first thing we're going to look for is hip extension. So go ahead, bend your knee, raise it up. Good. Okay, so we want to see 30 degrees of extension. That's decent. He has to cheat a little bit here, but it's not bad. We can get pretty close. Okay, go ahead down, Paolo. And then go the other side, bend your knee, go ahead up. So more of a struggle on this side. So hip extension on this side's less than optimal. This is more normal. All right, now we go to looking at kind of flexion of the heel to the butt. Okay, so knee flexion, and that's really pretty good. Okay, this side, and there's more restriction here. So he's actually switched. So knee flexion on this side is reduced, hip extension on this side is reduced. Now we go to rotation of the hip. All right, any runner that I work with, or lifter, CrossFitter, those kinds of populations, we want to have these all check off good by the end of the treating. So we'll look at internal rotation first. So moving the foot out. All right, that's internal hip rotation. That's got to be 45, that's clear, and external. And so we want to see this leg actually lie all the way down to 80 degrees. He can't get it unless I force it and get him there. So that's restricted. This side, go ahead, internal, Paolo. Good, a lot of motion there, and here, not so much. So he's somebody where we want to actually build back his ability to go external while the internal is already pretty good on both sides. Okay, so We'll follow up with a series of videos on how to improve some of these qualities of movement, but for Paolo, it would be a lot of work on this hip to get the external rotation back and the extension, and then on this side to get more length in his quadricep and the ability to flex the knee better. And that's kind of how you go about problem solving on your own as to what your deficiencies are. Okay, so thanks very much for watching, and once you've spotted your problems, you can tune into following episodes and figure out what you're going to do about it to improve your imbalances. Thanks very much, and see you next week.